Welcome to this explainer. Okay, let's dive right into this. Today, we're going to unpack a sudden and frankly pretty unpleasant public health crisis that's currently sweeping across the nation.
What is hiding in your salad? Now, I know that sounds like a cheesy horror movie tagline, but it perfectly sets the stage for a microscopic medical mystery hiding right on the dinner plates of people everywhere. To give you a sense of the sheer scale we're dealing with here, 843. That's the number of confirmed CDC cases of cyclosporiasis just between May 1st and July 9th alone. But honestly, that's really just the tip of the iceberg. Public health agencies are currently investigating over 1,500 more suspected cases spread across 31 different states. Now, what's really interesting about this data is how incredibly uneven the outbreak is. Michigan is bearing the absolute brunt of it, literally seeing over 1,000 cases diagnosed in just a 2-week window. Then you've got New York with nearly 300, Ohio at 177, and Illinois sitting at a higher than average 141 cases. Section 1. Meet the microscopic culprits, Cyclospora and Cryptosporidium. So let's define the threat clearly so we know exactly what we're up against. Cyclosporiasis and Cryptosporidium, which most people just shorten to crypto, are intestinal illnesses. The key thing to grasp here is that these are caused by microscopic parasites consumed through contaminated food or water. They're actually a lot less common than your typical foodborne bacteria like Salmonella or E. coli, but as we're seeing right now, they can spread like wildfire. It's a crazy contrast when you think about it. On one hand, you've got this entirely invisible microscopic organism. On the other, the massive macroscopic disruption it causes to everyday life. Because despite their tiny scale, these invaders wreak absolute havoc once they reach the human digestive tract, specifically targeting and setting up shop right in your small intestine. Section 2, Symptoms and Infection Timeline, also known as the misery life cycle. Let's move to the timeline and see how this builds, walking through the chronological life cycle. Day 0 is when the initial infection happens via that contaminated food or water. Then, the parasite just hides during an incubation period lasting from day 2 all the way to day 10. Symptoms typically hit, on average, right around day 7. And what makes this bug so incredibly frustrating is that even after the symptoms seem to clear up between weeks 2 and 4, they can mysteriously come and go for up to 30 days if left untreated by a medical professional. So, what exactly happens on day 7? Well, public health agencies use a very direct and honestly startling quote to describe it: frequent and sometimes explosive bowel movements. It really highlights the severe reality of the main symptom. Let's just say, if you catch this, you definitely do not want to be wandering very far from a restroom. The rest of the symptoms include a pretty nasty lineup. We're talking watery diarrhea, stomach cramps, nausea, vomiting, fever, weight loss, and dehydration. But there's actually a super interesting biological fact here. According to the CDC, people who've been previously infected with crypto can quickly make antibodies. This means if they ever encounter the parasite again, reinfections usually result in far fewer symptoms, or sometimes no symptoms at all. Section 3, High-risk populations, and when it gets severe. So, the crucial point is that immunocompromised groups are at the absolute highest risk here. This includes people infected with HIV, cancer, or transplant patients taking immunosuppressants, and folks with inherited immune diseases. For these specific groups, this isn't just your standard stomach bug. The infection can dangerously spread way beyond the intestine and into the respiratory tract, the biliary tract, or even the pancreas. And this explains exactly why this matters so deeply. For high-risk individuals, catching this parasite can lead to chronic illness, severe muscle wasting, and a sudden, life-threatening inability to digest or absorb nutrients from their food. It can literally turn a plate of contaminated greens into a severe medical crisis in no time. Section 4, Protecting Your Plate. Let's look at some actionable takeaways. So let's break down some concrete prevention protocols issued by the Michigan Health Department for your next grocery run. Step 1, wash those greens thoroughly. Step 2, remove the outer layers of your lettuce and green onions. And Step 3, cook your raspberries and leafy greens whenever possible. Now, I do want to note that while these steps aren't medically proven to be 100% effective against these specific, stubborn parasites, they are absolutely your best line of defense right now. Finally, I want to reassure you with this number: 0. Despite the rapid spread across 31 states, and despite the 86 hospitalizations reported so far, there have been exactly 0 deaths reported from this infection. It is an incredibly miserable experience, for sure, but it is highly survivable. Which brings us right back where we started, leaving you with this final thought.
What is truly hiding in your next salad? I hope this explainer urges you to take your at-home food prep seriously, empowers you with the facts of this current outbreak, and leaves you curious to learn more about the fascinating, invisible world of food safety. Stay safe, wash those greens, and keep learning.